All right. Well, good afternoon, everyone. I'm Angie Murad. I'm a patient educator here with the Mayo Clinic Cancer Education Program. I will be moderating this session. We're glad you're with us for this live webinar titled Radiation Skin Changes, presented by our own patient educator, Terra Register. We want people on this webinar to know that we are recording this session so that individuals who are not able to join us for this live session can watch it later. For those who would like to view this webinar again, the recording takes, just to let you know, it takes about 3 days to be edited and then put on our video library tab on our cancer education group, Mayo Clinic Connect. And just to let you know, the Mayo Clinic Connect is a digital platform where patients, family members, and caregivers can connect with one another and get evidence-based information and get access to information about classes that our Cancer Education Center offers. We encourage you to follow our cancer education blog on Mayo Clinic Connect so you can stay up to date on upcoming webinars and other educational opportunities. So just to let you know that I will put the link for Mayo Clinic Connect Cancer Education in the chat once we get started. And then two, if you want to sign up for, or take a look and sign up for other webinars that we have coming up, click on the classes and resources tab to find out more. And there'll also be a register here link that you can just click and register, and all of those are available at free. So I'd like to just take a quick moment to announce some upcoming webinars that are coming in April and May. So on Tuesday, April 26th, we will have a colorectal cancer town hall with Dr. Timothy Woodward, who is a Mayo Clinic gastroenterologist. Then too, we wanted to highlight a 3-week series on financial toxicity and cancer. So those will be throughout May. And then on Thursday, May 12th, we have another webinar on melanoma skin cancer awareness. And then just something, we don't have the date set yet, but look for in June a survivorship series that will be starting. And we're planning on doing that the first Wednesday of every month. So just to let you know about that, and you can find out more again on the link that I'll be putting in the chat. So also too, we will be taking questions at the end of this session. So if you have questions related to this webinar topic, please type them in the chat function at the bottom of the Zoom screen. So I'm pleased to turn over this presentation to Terra for her right now. Okay, go ahead, Terra.
All right, good afternoon. Thank you so much, Angie, for your graciously introducing myself. So like Angie said, my name is Terra Register. I am a patient educator here in the Cancer Education Center. I also have a background in nursing, but my passion is within the field of oncology, and so is and also the radiation treatment aspect. I have been embedded in education and research for nearly 4 years of my 13-year career with Mayo Clinic. During this session, I will cover radiation skin changes, a potential side effect that may occur with treatment. Of course, this may not always be the situation, but it is good information to know and learn about just in case if you run into this during or after your treatment. All right, so in this session, like I said, I will go ahead and discuss the following topics here. So how skin is affected by radiation. We will be looking further into the skin and how radiation can affect it, what health issues can affect your skin's recovery during and after radiation. I want you to think about those items and which can help you change to help skin healing. Some prevention steps and tips to help reduce the severity of skin changes. And also how you can prevent your skin from further breakdown. Identify types of skin changes that can occur, the characteristics, possible treatments, learn those skin changes look like, and report to your care team. I will also discuss a few minor points and when to contact your team, and if your condition worsens, what are the concerning signs that your skin is showing that maybe you should notify your care team immediately. Lastly, a few tips for post-radiation care. teach you some of those items that you can do at home to help your skin recover directly after radiation treatment is completed and the long-term care moving forward. All right, so before we get into the specifics of radiation and the skin changes, I wanted to show you just a diagram of our skin and the layers that make it up. As you can see the diagram here, it shows all those layers that our skin has for protection. This is why our skin is so important, because it helps protect us from infection and other potential dangers. So to get a better idea of what is in these areas, I'm going to briefly cover what is in those layers here. So first we have the epidermis. So that's the first layer of the skin. So no blood cells, but mainly contains like hair follicles. During normal skin regrowth, cells are shed through the normal shedding process. New cells are formed in the basal layer, which is just at the bottom of that piece there. The basal layer of the epidermis, it kind of increases rapidly. So it's particularly sensitive to radiation, okay? So the dermis is that second layer there, right in the middle, located between the epidermis and the subcutaneous tissue or the fat. It contains capillaries or small vessels that help supply nutrition to the epidermis and those sweat glands, okay? The subcutaneous tissue, which is that very last layer of defense. So this contains the fat cells that protect your veins and your arteries of your body that supply blood to those larger important organs, okay? It is another layer of protection and insulation for our body and temperature control. The skin is very durable. So, but when it comes to radiation, it can break down over time. Okay, so radiation needs to pass through the skin and other structures or areas of the body to get to the tumor. Of course, every effort is made to avoid those important areas that should not get any radiation. But over time, the repeated therapy to the same region can break down some of the skin cells, starting from that top layer, like we talked about, the epidermis, and moving further down through the basal layer and then the dermis, or even the subcutaneous fat, okay? So it will be expected to get some sort of irritation on the skin, but understanding the potential of skin irritation and having those conversations with your care team will help determine your risk and how to prevent any worsening effects that will, save you in the long term as you receive your treatment. So right here I have, as you can see here, I have listed some of the causes that can lead to worsening skin changes from radiation treatment. There are two separate categories listed here: what can influence your skin's reaction and its ability to heal. The first category on the left is the internal factors. So some of those leading causes. For example, I have listed some of the things that we cannot control would be like our age or being immunocompromised and some of the medications that we might have to be on. But certainly if you have antibiotics, those can affect your skin's reaction as well. But it is important to let your providers know that when you're starting on a new medication while you're receiving treatment for your cancer. Other things that we can control within that internal factor is, our obesity. So managing our weight, doing those exercises, those kinds of things. Some of the comorbidities, this would be like a type 2 diabetes, not diabetes type 1, or maybe some hypertension, as long as it's not hereditary. Any chronic long-term sun exposure, those could be some things you can, change. Smoking, that's another issue that is a big topic as well when it comes to taking care of our skin. Some of the external factors, those would maybe more so involve the radiation itself. So the type of radiation, you could be receiving, different types of radiation. There's the photon, proton, or brachytherapy. Is it internal or an external radiation? How about the amount of radiation, meaning the dose, of radiation per visit? There are some questions that you can ask as you're going through the process. So what is the total amount of you will be given? Is it a higher or an average dose? Will you be getting radiation once or twice a day? These questions will be dependent on multiple factors, of course, learning more about how they determined your specific dose, but you'll need to refer to your treating physician to get those answers, okay? Combine the combination of radiation and chemotherapy. Already your body cells will be working very hard when going through chemotherapy. So now adding radiation will increase that amount that your normal cells are working to fight off those cancer cells. The area of treatment, that's a big one. So areas where there's more bones closer to the surface, larger areas of treatment, for example, it could be the head, the neck, maybe even the chest where, there's not a lot of fat near those areas. Thus the skin is more prone to, the changes from the radiation. So keeping a close eye on that would be beneficial as well. So during radiation, it is important to help prevent any worsening symptoms of skin changes as possible. But there is a chance you may not see any skin changes, or maybe the effects, you won't see any of the effects right away, rather it will build up over time. So for example, imagine you're out in the midday hot sun without any sunscreen every day, okay? But only for a short time. Now let's add that you keep going out in the sun each day, the same time, midday hot sun being repeated without sunscreen. This can lead to damaging effects on your skin. Therefore, your skin would burn unless you use precautions like sunscreen. So therefore, self-care and closely monitoring your skin can help your team best take care of you. As you can see, there are many things that you can do at home to help care for your skin and lessen the severity. Avoid scratching or itching to the treated area, only applying lotions or soaps that are recommended, unscented, of course. Ask your team if you can use deodorant or if you have any prescription creams. Drinking plenty of water, staying hydrated, helps your body recover faster. These are merely only a few of the examples, but certainly there may be more instructions from your team as you go through your treatment that is more specific to you. So moving forward with some of the additional precautions to take with your skin while you're going through treatment. So you want to wear loose fitting clothing that is soft like cotton versus wearing a tougher, rougher clothing, which can create more friction and irritation to the treated area. Avoid sun exposure. The treated skin may burn more easily. If you remember my example about the sun exposure, just keep these in mind. So if you must be out in the sun, wear a liberal amount of sunscreen with at least an SPF of 30 or higher is better. Wear protective clothing when you're outside, including a hat or long sleeves or pants, something that covers that treated area. Avoid taking hot showers or baths. This can burn or blister or break down your already sensitive skin. It is recommended that you should not shave that area that is being treated as well. For instance, a treatment field that includes maybe the armpit or the leg. It is also encouraged that if you are a tobacco user or a smoker, that finding sensation or quitting will aid in skin healing. So as I said before, factors externally that can influence your skin. So here shows how that can be related. So try to maintain healthy tissue and closely monitor your skin changes for early prevention and treatment of worsening side effects. You will not notice these right away, but again, if you notice more redness, itchiness, some like blistering or breaking in the skin, notify your care team so they can help figure out the best treatments to decrease further changes and discomforts and help that healing process. Again, your symptoms will depend on those factors we've already talked about already: the site that's being treated, the treatment dose, how often, length and days of treatment, your status as well. Are you normally healthy other than your cancer? Are you a smoker? Do you have other diseases that prevent healing, such as diabetes or other blood disorders that affect your circulation? So the pictures here, I want to show you just for some comparisons of some of the skin reactions that are more commonly seen if they happen during your treatment or nearing the end of your treatment. Okay, so there is a type of reaction that can occur, which appears like a sunburn. The left picture there is redness present, and maybe some slight blistering depending on the location of the treatment and the dosage that you're getting. Whereas the middle photo, dermatitis, this is when the skin becomes kind of blotchy, itchy, red in the treatment area, but you must avoid doing that itching or the scratching because these areas can become infected. So ask your provider for recommendations to help ease these symptoms if they do show up. The moist skin reaction, that one's on the right. So it involves the top layer of the epidermis and the skin that is peeled, leaving behind some of that dermis that we talked about. This has an appearance of a moist reddened skin. So as you can see, this is less comfortable of the reactions that can occur. The picture shows an area under the breast where the skin has become inflamed, red, slightly painful. You can also see the slight shiny appearance as well. Interventions are needed, especially now, to prevent any further skin breakdown. A point to remember is that any rash that will only occur in the area that's being treated. For example, if you are being treated in the breast area, you will not have a reaction rash in another area, for example, like the foot. Okay. So these are merely just a few examples of what your care team or provider may prescribe if you are needing more extended plan to treat any skin reactions. Please, before proceeding to use any creams or over-the-counter lotions to the treatment area of your skin, ask your provider which they would recommend to treat your condition. Some over-the-counter creams could actually worsen your skin condition or enhance the burns you may get while receiving your radiation treatment. Your provider will let you know the type, the amount, and how many times a day and length of actual treatment over the course, meaning days you should be using these applications. With the moisturizing lotion, there are just a few examples, but of course, they're all unscented, and that's the key point here. So when to contact your team. So if you are displaying a temperature of 100.4 or greater, if your skin to the treated area becomes that red or swollen or warm to the touch, if the area in question becomes to have like a yellowish crust or a draining, or also if the treated area has an odor. These are only just a couple of the topics where you would need to reach out to your radiation team for the side effects or any risks of infection. So infection can happen if we don't educate you and help you understand what to watch for, watch on your skin is, if you are at risk. So pay attention to your body. If something seems off, don't hesitate to bring those questions to your team or those concerns. Okay. So radiation therapy may continue to affect your skin after you're done with treatment. So listed here are some items to consider as you prepare for treatment, finish your treatment, or have finished your treatment already. It is common that if you have radiation, that the treated area can have some slight thickening of the skin. This is called fibrosis. Because radiation can cause some trauma to the skin surfaces or as cells repair themselves, they become thicker, thus developing a scar tissue of sorts. So as said before, radiation is a continued buildup in order to treat cancer. So radiation can remain in the body system for weeks post-treatment. This also applies to the skin and seeing changes in your skin. Continue to monitor for the redness or darkening to that treated area. Your skin is, even after treatment, is still sensitive for up to 4 weeks, especially when it comes to the sun. It is recommended to still take caution and cover that area as if you are at an increased risk, as you are at an increased risk for skin cancer to the area. So I encourage you to reach out to your treatment team if you need to take other precautions for your after treatment period and your follow-up care. All right. So that was my short, brief presentation, and we can take this opportunity to ask any questions if you have any. But again, if it's anything specific related to your treatment or maybe some symptoms you may have, I would encourage you to reach out to your treatment providers for the best methods for treatment.
If anyone has any questions, you can type them in the chat and Tara would be happy to answer them. That was a great presentation, Tara. I guess it's good too to realize that how, I mean, it makes sense that it's only the affected area, but I didn't know too if people, I'm thinking of like medication, sometimes those can affect other areas. So it was good to know that it's just really with the very specific area that's being treated that you'll see those kind of types of skin changes.
Mm-hmm. Yeah. There's a lot that you don't know unless you're made aware of it. So yeah, it's a great understanding to just realize that even something as simple as wearing deodorant could potentially affect that as well, just because there is that barrier there.
No, that's true, because it can make you those kinds of things you wouldn't think necessarily, like you think you're just doing your regular routine, but yeah, you need to ask your providers those types of questions of what things you might want to avoid. Yeah. So no, that's good. I apologize. Didn't put the connect link in there, but I just put it in the chat. So if people want to find out more on our webinars, please grab that out of the chat. And we'd be happy to have you look at some of our webinars and classes. So no, that's good. Good. And then one other question I was going to ask, you were saying that over time, people may experience more issues with skin changes. Is that typical, or, I mean, can it vary depending on the region, or the dose probably too? Yeah.
It really does depend, but just because radiation, you're receiving, radiation typically, Monday through Friday for a normal case. If it's once a day, the radiation builds up each day, and it's just more of a cumulative effect. So this is because the radiation builds up, so you're typically not seeing many symptoms until later on. But not always are you going to see skin changes. It really, it's very variable, but it's also really good information to be aware of, just in case if you start to recognize some of these symptoms. So and how to navigate that, and how to prepare, or preparing yourself to ask those questions, or what precautions do I need to take, even if you're not showing any symptoms while you're receiving radiation and you want to go out outside in the sun or have that exposure. You still need to take the precautions and wear that sunscreen and covering those areas, just because that area is being treated with radiation, and then you're exposing yourself to more UV rays. So that can build up.
Oh, very good point. Yeah. No, very helpful. Yeah, and I think just what you said, Tara, too, is sometimes we don't know what we don't know, right? So we don't even know to maybe ask those questions of our provider. So good things to know about. So if you are going to receive radiation as a treatment, to ask those questions. So great. Well, good. Well, I don't see any questions. It's a very quiet group. So you must have covered everything that was needed. So perfect.
Great.
Well, good. Thank you so much. Everyone have a great day. And if you want to watch again, like I said, it'll take about three business days. So they don't do it over the weekend. So probably like towards the early part of next week, it should be up on Connect. Okay. Have a good day. Bye.
Thank you. Bye.